It's my pleasure to welcome you on behalf of the Georgia chapter and as well as on behalf of the National Board of Directors of the Scleroderma Foundation. For those of you who I have not had the pleasure of meeting, my name's Robert Riggs and I have the great honor of being the CEO of the Scleroderma Foundation, and I welcome you to our 15th annual conference, 15 Years of Fighting Scleroderma. It is with great pleasure that I get to tell you this morning that we have a terrific keynote speaker. Seth Ginsberg, many of you may remember from a couple of years ago, who addressed us at a closing keynote, and backed by popular demand, we're happy to welcome him here this morning. Seth is a patient advocate and a spokesperson who at the age of 13 was diagnosed with spondyloarthritis, an autoimmune disease, who understands very well what many of you in this room are dealing with. He decided that there needed to be more awareness and attention brought to autoimmunity in general, and he set about very early on in his life, because right now he still looks like he's 12 years old, he set out to do something about it. And he co-founded Creaky Joints, an arthritis advocacy organization, and part of the Global Healthy Living Foundation, which actively advocates on state and federal levels for improved access to care for patients. And he's taken his message throughout the United States and beyond, and he is truly a global leader and thought leader in the world of autoimmunity and patient access, and he is one of my personal heroes. I've heard him speak many times at different organizations around the country, and I can't be more excited to welcome him here this morning. So please join me in welcoming Seth Ginsberg. Seth?
Thanks. Hi, everybody. Good morning, Atlanta. It's Georgia. Did everybody have a peach? Thank you so much, Robert. I really appreciate that introduction. That was very kind of you. And boy, time flies since I was here last year. And, as the saying goes, he who closes Keynote opens next Keynote. So I really am very thrilled to be here, and I want to extend a thank you and a true, sincere gratitude and appreciation to the folks at the Scleroderma Foundation for including me here for the second year in a row. And I just want to let everyone know that you're my family. We're all family. We are in this together. And so when I visit and when we get to hang out and we get to meet one another, I think to myself, this person understands better than anyone else I've met what it's like. And when you look around the room, you could think the same thing of everyone else that you see and everyone else that you meet. We are in this together. We understand what we're going through, and there's strength in numbers. To me, this is the most important group of people and the most important gathering out there today. And I'll contextualize it. We may not be the largest group, although as I look out here, I see so many new faces and so many returning and old faces from years past. But this hotel also hosted this weekend a group called 31 and something. You guys, everyone saw these folks. I came here last night. I got in late. I thought, wow, this is wonderful, a huge thing for breast cancer. But it turns out these are just a bunch of women selling handbags. 16,000 women came here this week to sell handbags, but to learn, more importantly, how to sell handbags better, to exchange best practices, to talk about what works for them, to talk about things they can do that might help them sell more handbags. And then I think about our group, and I think about our family, and I think about the reason we're here. And I can't underscore this enough. We're here for a much more important reason, and that's to feel better. That's to make it through our day a little easier, and that's to help one another. So while they may have a few more folks in attendance at their conference, I believe in my heart that we are more important when it comes to the reasons for being here together and the things that we're going to talk about during this weekend. So it really is great to be a part of today's conference, and I really do. I have a very special place in my heart for the Scleroderma community, for my friends at the foundation, and of course, for all of you. See, when I was here last year, I spoke about how we can make our voices heard on Capitol Hill or throughout the state legislatures all around the country from where we're from. And when I said our voices, I meant that advocacy is a family affair. Everyone can represent this condition with a unique viewpoint, whether it's our mothers or our fathers or our brothers or sisters or spouses or cousins or neighbors. All of us can represent scleroderma regardless of whether or not we live with us. We live with it. And that's so important because we all, or at least when we turn 18, we all can vote. So regardless of whether or not we're the ones walking around with the scleroderma, or if we're a family member, a friend, or a neighbor, we can still represent the viewpoints of scleroderma to the legislators and to the elected officials and to those in charge because we have a viewpoint that's meaningful. So today, I want to actually talk about something a lot more personal, a lot more individual. I want to talk about our responsibility to ourselves. And by ourselves, I mean each of us as patients, as well as all of us as a patient group. This something I'm talking about is our valuable role in getting better by knowing ourselves better, by understanding our condition better, and then by sharing what we've learned with others. And it's going to take a lot of exciting shapes and forms. And it's going to involve taking the time we need to take, not just to write an email to our legislators, but to participate in research, to participate in the knowledge that's growing about what we're living with. And I want to highlight the most exciting part about what's happening right here, right now. Across the hallway, there are, 50 doctors who are spending the day today learning more about scleroderma from the experts and the researchers and the people who have dedicated their careers to studying it. What does that mean? They're learning more. They're knowing more. They're going to treat us better. That's just so exciting to me. When I learned that there was going to be this kind of dual patient group, physician group track thing going on here, I was so excited to realize that the scleroderma community really is coming together to knock out scleroderma. And then when I realized that was today's or this year's conference theme, I was even more excited. It means the folks at the foundation beat me to the punch. But the point is, we're coming together, we're learning more, and we're all contributing to feeling better. And we couldn't have done this even 5, 10, 15 years ago, because today we have something called the internet. Today we have something called a smartphone that never seems to have enough battery life, does it? Today we have so many different ways to talk to each other, to share our perspective, to provide our input into what we're dealing with, how we're going about our lives, so the people who treat us and the people who are researching our conditions, they can understand a lot better what it is that we're going through. Think about this. When I was diagnosed with spondyloarthropathy, I was 13, so that makes it 1994, which, if you do the math, means I'm turning 32 this year. And back then, we knew about that much, literally. There was very little that we could learn about my condition, your condition, our conditions that we couldn't, the only thing we can learn was basically what we could figure out in a laboratory, what we could figure out in these sterile environments of research. Whereas today, all these years later, in the year 2013, you turn on the news, the world is imploding. But when you wake up and you keep the news off and you look around, you think to yourself, we have some remarkable technology at our fingertips. And that technology is dramatically accelerating what we know and how much of it we know. And by bringing all of our collective experiences together and participating in the process, imagine, I mean, we are literally slingshotting ourselves forward, and it's so exciting. And weekends like this, groups like today, coming together and understanding the potential and the power that we hold, not just to get laws passed, not just to get funding earmarked for the NIH to do research, but to we ourselves participate in the process. All it takes is filling out a form online once a month that maybe is 5 minutes of your time. But it's something called patient-reported outcomes. The things we need to share with our doctors between visits, or the researchers and the folks who are examining the total group. Think about it. You know, I borrow a page out of my friend's books from the Crohn's and colitis community. I have a good friend named Sean Ahrens, a 24-year-old Berkeley genius programmer with Crohn's for most of his life, unfortunately. Sean set out and created a website called Chronology. And the point of Chronology is to allow everybody with Crohn's to log in and share how they're doing before, during, and after that salad they ate, even down to take a photo of the food they just had. Because when you add up thousands of experiences with these salads, or the medicines, or the exercise, or all the other things that contribute to feeling better, when you add them up, when you aggregate them, the answers become clear to us, or at least shed some light on things we should think about. I mean, think about it in those terms. Consider, we are here as a group. There's like 1,000 people in this room. And if all of us, and this is where it gets really exciting, if all of us can contribute how we're doing based on what we're doing, what medicines we might be taking, what little techniques we use to get a better night's sleep, and I'm more than happy to hear what you're doing because I could use it. What we're eating, how we're exercising, the mental mindset we put ourselves in every morning. If we can aggregate all of this and share it in some way, don't you think we're better off? Isn't it more exciting today than it has ever been because we have those opportunities now? Well, I'm really excited about this. As you can tell, this is something that I obsess over now. Guys like Sean and many of my friends, researchers and experts from all around the world, have been knocking on our door saying, Creaky Joints and the Global Healthy Living Foundation, here you are, you're a nonprofit, you've been around 15 years, you're like the most popular arthritis community in the world. That's what we are now. And that's because we have an average of about 250,000 folks hanging out with us on Facebook every week. 250,000 people who have inflammatory arthritis, all different kinds, rheumatoid arthritis, spondylitis, psoriatic arthritis, scleroderma, lupus, you name it. These are all people who hang out with us on Facebook. And here we are saying to ourselves, wait a minute, all these people, with all of their experiences, with all of the little nuggets of things that are working for them or not, if we can find a way to bring it together and then to analyze it and let the smarter people take a look at it, maybe we can glean more information. And the way Sean has set out to cure Crohn's by writing this software and this program, we have set out to make life with inflammatory arthritis and all of these autoimmune-related conditions better because it's the least we can do. Think about it. Our days are full of things we really don't need to do, but we do anyway. What about the 5 minutes we can spend once a month filling in some important information? Maybe it's on our smartphone, maybe it's on our computer, maybe it's by hand on a piece of paper that we give to the doctor. But the point is, we are bringing this information together, and that is going to make us feel better. And I really just want to make sure everybody is as excited about this as I am, because we have a really bright future, because technology is going to help us. There are so many unanswered questions right now. But at least knowing the questions to ask will allow us a chance to start searching more specifically for those answers. So who's excited? It was awesome. You know, it comes down to this. We can allow our fate to be written by others, or we can take steps to engineer our own future. And you came here this weekend and you took leaps to engineer your future. And you're going to learn more. You're going to meet great people. You're going to walk away here feeling better than when you came. So you're already ahead of the curve. My job, or at least my goal, is to make sure that you think about these things in a way that after this fantastic weekend, perhaps after you meet a new lifelong friend, you go home, you stay in touch, you share each other's emails or phone numbers, and you make sure that you keep talking, because you're going to coach each other through this process, and you're going to share with one another the things that you pick up along the way, the opportunities that you all have to contribute really important information to the greater good, so that together we could feel better. You know, there's this slogan from this bank growing up, and I just want to make sure everyone knows I didn't write this, but I love it, called "None of us is as strong as all of us." A bank wrote that. Can you imagine? A bank. But it's true. None of us is as strong as all of us. And here we are, all of us, together in this room, eager to learn, eager to share strength, experience, and knowledge, so that together we can leave here feeling better. Awesome. So, I wanted to have a little bit of fun too today, and I really wanted the opportunity to share some perspectives. So the first was, of course, this notion that we are all going to work together in the future to find a cure, to answer questions, to feel better. And Creaky Joints and the Global Healthy Living Foundation is just laser focused on this. And I want to make sure everybody knows that if you go to creakyjoints.org, you can sign up for our newsletter, which comes out every other week. And I'm very excited to announce that come next month, by Labor Day, touch wood, we're going to be launching a whole new website, a participatory medicine site for all of us with inflammatory arthritis and the different autoimmune-related diseases, to not only understand exactly what information is out there, which is new and relevant but easy to understand, but we'll also be able to immediately link up and talk with one another. We'll be able to understand what the Scleroderma Foundation or the Lupus Foundation or the other organizations that might reach out to us is doing on that day, so we can stay in touch with our respective groups. And then most importantly, we're going to be able to give back. We're going to be able to give back experiences, information, perspectives, and all of the different outcomes that we're experiencing based on who we are, what we're doing, what we're taking, and how we're feeling. All of this information, that's all we ask from anybody. We'll never ask for a donation. We'll never solicit for fundraising, but we do ask that everyone participate in the process, because I really believe none of us is as strong as all of us, which is why we built this platform to let the scleroderma patient community, the lupus patient community, the rheumatoid arthritis patient community, all of these different related families of patients and their caregivers and families to come together, share their experiences, and contribute to the greater knowledge. And then take something back from that and see what's working and what's not. It's a very exciting time. I just want to make sure everybody is aware of it and has the opportunity to participate in it. And we'd be very disappointed if you didn't at this point, because it's our job, it's our duty, it's the one role we have to play as patients to make sure that those doctors out there know as much about us as possible, which is a segue into our next segment. It may feel like a very lonely world when you live with scleroderma or a related condition. And believe me, I understand this. It could be the most isolating feeling ever to wake up when even your spouse doesn't understand exactly what you're going through, or your family members don't understand why you're freezing, or whatever it is. And that's something that can often contribute to us actually feeling worse. And so the reason I was so keen to get Creaky Joints going as a freshman in college from my dorm room bunk bed was because I felt terrible feeling all alone in a college setting where, trust me, the last thing college kids talk about is arthritis. But this was in the 90s, and I said, there's got to be a way to connect with others. And that's how we got started, and that's why we built Creaky Joints, with the very generous support and the vision of a wonderful social entrepreneur and co-founder, Lou Tharp. He and I have been together ever since. I've got the arthritis, he's got the height. And together, nearly 15 years later, I believe we have built a worldwide community. And I want to prove it to you, because I want to make sure everybody here meets my friend, Dr. Roger Levy. See, Roger is a rheumatologist in Rio de Janeiro, Brazil. Has anyone been to Rio? You're from Brazil. Hey. Obrigado. So Roger and I met, I don't know, maybe a decade ago at a rheumatology conference. And here was this young guy and a physician who had a smile that was so big I could see it from across the room, and it was infectious. And I thought, he I want to meet. He I want to know. And since then, we've become just really close friends. And the point here is that Roger, we have a video, because this week, with Christine's help and the team here, we were able to film a little bit of a Q&A with Roger, because I just want to make sure all of you know you're not alone. And I want you to meet a doctor, a professor, a passionate caregiver of those of us with scleroderma or other forms of arthritis, and understand that he's working really hard in the southern hemisphere, and he's traveling all around the world, and there are patients like us everywhere who speak all the languages of the world, and we're not alone. And this group here represents a great step in the direction of feeling like there's strength in numbers. But imagine how big this world is and how many people there are out there. So, Christine, if we could throw up the video of Roger.
National Patient Education Conference in Atlanta. So could you just tell us a little bit about what you do as a rheumatologist in Brazil?
Yes, first I'd like to thank you for this opportunity to be with you a little bit far away, but I'll be there. And like to congratulate you on this effort. I know it's not easy to put up a meeting and to give more education to patients. It's a great effort. I'm a rheumatologist. I was graduated in Brazil in '86, and I did my fellowship training in rheumatology at a hospital for special surgery in New York. During the '80s and early '90s, I came back to Brazil, and since then I'm practicing as a rheumatologist, and then became a professor of rheumatology at the State University of Rio de Janeiro, near the Maracanã soccer stadium in Rio. And I run, among others, the Scleroderma clinic at our university hospital, which is a referral center for patients with scleroderma. We work very closely with the vascular team and the lung team and the dermatologist as well. So we have a multidisciplinary clinic. And for this past 25 years, we've been seeing many, many patients, and we've been witnessing great improvement in the way we are caring for these patients. So having less side effects from medication, earlier diagnosis, which is very important. And there are several things that we learned from practice that we would like to share with you. Some advices that may sound obvious, like protecting from the cold if you have a bad rhinos, and even if you don't have. But all my students are used to see me talking about manicure. You know, in Brazil, there's this big thing about having your nails done, and I think it's something that all the females are worried about. And we see so many accidents from silly things that can start from cutting the nails in a not proper way. So this is something that I learned from experience, that there is a proper way of taking care of your nails when you have rhinos. And it's like I tell my residents and my students, every time you see your patient, you should talk and remind them of this so important issue. It's like talking about avoiding cigarettes, even thinking about smoking, talking about pregnancy and the plan of contraception, and when is the right time if you're planning to get pregnant one day. This is also very important. So it's something like we should have a good relationship, transparency. The patients should not have like a secret plans. And when we're talking about your treatment and you're sometimes thinking about something else, we want to know what you're thinking of. And if you want to know what we are thinking of, you should ask us, and we should be the more clear the possible. You know, if sometimes patients, we know, you know, you're taking this medication for 10 years or more, you change the dose, you stop for some period of time, and we should know. We should know what's going on. We should know if what's written in the prescription is the same that you are doing when you're there at your house. We should know what's the questions in everyone's minds about side effects, fear of taking this or that, of not exercising or doing the wrong exercise, which is the right exercise to do, about diet and the ways that you feed yourself. You know, we can help, but we should know what's going on. And the thing that's making the treatment more difficult in nowadays is the communication, the lack of a good communication. Like patients that are afraid of telling what they're saying because they fear that the doctor will yell at them or will not we lose the patients, you know, we'll not understand. So what I'm going to tell you from our side, the physicians, the rheumatologists, the lung specialists, we want to do the best for the patient, for each individual person. But we should know what you're thinking about the adherence to treatment, your fears, what you understand about your disease. No one is like the other. So sometimes you're sitting at the waiting room and you think that you're going to be like the person that's next to you. That's not necessarily true. So we're learning from the persons that have been living with scleroderma from a longer time. We learn from them. But it's not necessary that somebody that will have a diagnosis in 2013 or 3 or 5 years ago will have the same disease that somebody that had the same diagnosis in 1990 or in the year 2000. Because we learn a lot, and there's a lot of progress. Of course, there are still many unmet needs, and you know that, and room for improvement. But we are working hard, and we should work together for this. So we should know from patients what are the most important unmet needs that we should address in clinical trials that will become in a larger number, will be showing up for us. Sometimes we think that this is important, and for the patient community there's another issue that is as important as, or even more important than what we are thinking. We are worried about the lung progression. This is something that we know that can impair quality of life. And sometimes when we do the physical exam, the findings are not so important, but when we do a CT scan, we find something that's like silent, but we can treat early. So sometimes we order an exam that may be bothersome, it may take time and effort to perform this lab test, and you say, oh, I don't have to do it now, I can wait for another 3 months, 6 months. But this 3 months, 6 months could be the window of opportunity for treatment. So if we want to do a program, have your echocardiogram, your CT scan performed, it's not because we want to have a good medical chart to look at. It's because we have a plan, and because we know what to do when something is small, subtle, before it becomes a real problem. So we should have this plan, treatment plan, investigation plan, and even when you're feeling well, you should do the lab tests, perform the whatever we need from you, because this will help us take a decision. This will help us understand if the treatment we are giving you is good enough, if there is something else that we should give you. And I also, in addition to the Scleroderma clinic, I run the pregnancy clinic at our university hospital. And we started that mostly because of antiphospholipid syndrome and lupus patients, but we see also patients with all kinds of different forms of scleroderma. And what we learn from that is that those women in the first 2 years of Raynaud's early diagnosis is the time when we don't know well how is the disease progression going to be. So if we could avoid pregnancy in the first 2 years of diagnostic of systemic sclerosis, it's much better for everyone. That doesn't mean that you cannot get pregnant later, but in the first 2 years we don't know how is the lung behaving, if there's renal involvement. So it's an important advice that I would like to leave here. And also, again, the secrecy, like being transparent. Tell your doctor that you have plans to get pregnant one day, and we should adjust your medication. We know that ACE inhibitors, like bosentan also, is X. So we shouldn't let anyone get pregnant while on use of these medications, of endothelin inhibitors and ACE inhibitors. But on the other hand, drugs like sildenafil that can be very useful for us treating scleroderma are okay for using during pregnancy. Azathioprine is okay for using during pregnancy. Even prednisone, if you need for rheumatoid-like crisis, for arthritis, we can use. So don't plan to get pregnant without letting your rheumatologist know that's on your mind. And we should share you should share your fears and thoughts and beliefs. And if you have a question because you saw something on the internet or somebody in the waiting room told you, ask your doctor. Don't go home with that in your mind. Try to clarify it. And if your doctor explains it to you in a way that you don't understand, tell them. Don't be shy. Tell them, I'm sorry, I don't understand. Explain me more. Explain me better. Until you understand, until you feel well with the information. Because that can change the whole treatment, that can change your life, that can change your prognosis. So I think I touched the most important things that we see, you know. I see patients that smoke, and then we know that their treatment is not going to work the same way. We see people that are not exercising, and we know it's hard, but it's important. We see people that are not protecting themselves from the cold weather in the proper way. So it's not like your doctor should know your disease and give you the medication. There's much more than the medication. And if you do everything right, with the right medication, it's still difficult. So we should collaborate. Okay?
Great. Well, thank you, doctor. Now, as we conclude here, what would be the one big piece of advice that you would suggest to patients so they can help improve the patient and doctor relationship?
So it's about this agenda, having what we call a treat-to-target plan from both sides. We doctors should know what your dreams, your goals, your objectives are, what you want, and we should be able to help you understand what we can achieve. Of course, we want you to have the best life that you can have. And we are studying and trying to be updated and giving you the best medication, helping you have the access to medication, new clinical trials that are coming up. So people should understand that if you enroll in a clinical trial, you are helping the whole community all over the world, and they are very ethical. No one is going to do experiments on people with scleroderma. When we get to a phase 3 trial, it's been through a lot before, so we know about safety. We are finding the right dose on the phase 2. So phase 3 is larger numbers. So, and you should help us advise other people with scleroderma. So many patients that I see today were brought in by other patients, by patients with lupus that say, oh, I think she has something similar to me. She has Raynaud's. She's having difficulty eating. So sometimes you have something in your family. So, you know, the earlier we can intervene, the better for everyone.
Great.
So something that we share. It's our community working together. So that's why I think it's such a nice effort that you are putting all these people from all over the world together, and you are, helping us to help you.
Well, thank you so much for taking the time, Dr. Levy, all the way from Brazil, thousands of miles away from us here in Atlanta, Georgia. So I appreciate you taking the time today.
It's my pleasure. We'll be always here if you need us.
Just to demonstrate my commitment to technology, I have my phone here, and I hope you could join me in giving Roger a really big round of applause that I can videotape and then send to him. Wouldn't that be fun? So 1, 2, 3. I mean, was I right or was I right? This is a guy who's dedicated his life and his career, and all he wants to do is help us feel better. And he travels all around the world, and he visits with doctors and patients and researchers, and he brings his passion for helping others to the table. And to underscore the points he made here, I think is really important. And his email to me was, I have it written down right here, "This is our pledge, no secret agenda on either side." Imagine that. And I think he's right. We don't necessarily speak up when we talk to our doctor or our nurse. We just do this. Uh-huh, uh-huh, uh-huh. We leave there doing this. Uh-huh, uh-huh. And we don't need to. Get your money's worth, or at least your copay's worth when you visit with your doctor. Understand as much as you can and ask as many. Questions are free. Questions are free, and that's why the Scleroderma Foundation exists. That's why Creaky Joints and the Global Healthy Living Foundation is supportive of the scleroderma community, because we know that there are too many unanswered questions, and we are all here together to figure out the answers. And then that other point he made about participating in the research and the trials and such, I think is so important. I remember Roger told me this a long time ago. When it comes to smaller but mighty communities of very specific conditions like scleroderma or lupus or even rheumatoid arthritis, we really all need to participate in the process. And we have to take a little bit of a leap of faith, and we have to know that sometimes the fears and sometimes the trepidations are manufactured in our head. And when we learn more and ask questions of our doctor, we realize it's perfectly safe. It's been proven, whatever it is that we're talking about, to at least lead us in a better direction. So there's that clinical trial part that I want to underscore the importance of, because I am a firm believer in that. But then there's the got nothing to lose, gonna take 5 minutes out of your day once a month, once a week, once a year, and I'm going to tell people how I feel, what I'm thinking, and most importantly, what I want, that we all have to do. There's no excuses here. That's why Creaky Joints and GHLF is so focused on these patient-reported outcomes. So often researchers, they think they know what we need. And most of the time, they're right. But guess what? They don't have a clue what we want, because no one's ever asked us what we want. It's all about what we need. So when I say get involved in the process, when I say participate in research and be a part of collectively learning more about our condition, I mean tell people what we want as well as what we need. And that's why we're here. And that's what we're going to be doing in the future. Come Labor Day, touch wood, when our new site launches with Creaky Joints, we'll have all of these fun bells and whistles already laid out very easily so that everybody is invited to participate in the process of telling the researchers and the doctors who treat us what we want. And this is coming from the people who have spent the last decade and a half fighting relentlessly for the community to get better access to care, to overcome barriers to care, to stand up in front of Congress, to testify before the FDA, to be in state houses and legislatures all around the country saying, God damn it, give us what we deserve, respect, and also a quality of life that we want. And understand that we vote. So if you don't do it, we'll come back with a vengeance and you'll be out of a job. So we took that perspective and then we are now applying it to this newfound vision of saying, God damn it, listen to what we want, understand what we're going through better, so that you can do your jobs as doctors, as researchers, as scientists, and we can all be better off. So we have a couple minutes here. I thought maybe we could visit together, and if there are any questions that you might have before I wrap up here, I want to make sure that we all have a chance to get to know each other a little bit better. I'm most focused on making sure everyone feels better, but were there other questions, or were there folks who wanted to give a shout out? So this woman over here asked about medical cannabis and marijuana and the research that's being done in that field. Here is the problem. Currently, marijuana is a Schedule I narcotic by the federal government, so it's treated the same way as heroin. It's decriminalized, or it might even be legalized at the state level in 16 states around the country, which I'm sure you've read about in the newspapers. But at the federal level, according to the DEA, the Drug Enforcement Agency, marijuana is still a Schedule I narcotic. Therefore, anybody with any interest in doing any kind of research using marijuana here in the United States runs the risk of losing any funding their university might receive from the government, runs the risk of being shut down by the federal government, and runs the risk of really ruining their career. Isn't that crappy? I mean, I'm not here advocating for or against anything except knowing more. I've been standing here for an hour talking about research and quantifying the things that work and the things that don't. And in this first world country, or so-called first world country of ours, something as simple as a plant can't be studied with more rigor. So the only thing I'd have to say to that end is contact everyone who you've ever voted for, who elects you at the state and federal level, and just say, I'd like to learn more about marijuana. Could you help me find out? I think that's the first step. I really do. But I also want to learn a whole lot more about it. I want to understand how it impairs our driving. I want to know what it does to our lives. I want to know exactly how to measure it. I want to know exactly how to dose it. I want to treat it with the respect it deserves and not like something born out of the 60s long before I was born, or probably the result of why I was born. But that's a great question, and I'm glad you asked it.
I just wanted to ask you, thank you for giving us the feeling that we're not alone in the scleroderma and the autoimmune community. And I was curious, when you lump all of the autoimmune diseases together as we advocate, what numbers do you think we're talking about?
Millions. Millions and millions. Millions and millions and millions. I mean, literally, we're climbing toward 10 million people, and that's a conservative number. There are a lot of people living with autoimmune-related conditions, and none of us is as strong as all of us, which is exactly why, where'd you go? There you are. Which is why Creaky Joints, I'm so excited about next month, touch wood. You can tell the way I feel about developers. But I'm so excited because what we're going to do is we're going to segment everyone out, but then we're going to aggregate everybody. And we're going to de-identify you, so it's not going to be about you, Mary, but it's going to be about all of the Jane Does living with the condition, so we can take a much broader look at exactly what the trends are. I predict, if we do this right, we're going to answer that age-old question, does the weather impact our arthritis? Because I believe it does, and we're going to prove it because we'll map it against the weather map.
Seth? I have Lyme disease, which took 4.5 to 5 years to diagnose, even though I had a bullseye rash and was not given doxycycline by the first infectious disease doctor that I saw and who saw the bullseye rash. And in researching the clinical trials, people with autoimmune diseases are systematically excluded from trials because we will mess up the data. How do we systematically get put back into trials? Because we could have the same issues as the people who don't have autoimmune diseases.
It's a great question.
And we should be included in whatever the problem is.
You're absolutely right. It's kind of a random act of exclusion, I've always thought. And the advice I have to that end is seek out the right kind of doctor. Start finding other doctors that are more open-minded and willing to participate in these types of discussions and research, and who are willing to take a broader view of things and incorporate not just a very specific slice of patient type, but look at the people as a whole. And this gets back to what I was saying earlier. Research occurs in this vacuum. It's so not real world. It's unbelievable. And you know, I went to this lecture the other day. This visiting professor from Italy, he came in, he was talking about the hormones that are secreted overnight, and the corticos and this and that, and the melatonins. And the doctor raised his hand in the audience and said, "You're basing all of this research on something done in a sleep laboratory." I was like, you know, some people have sex at night. What does that do to hormones? Some people get woken up by kids, or some people get, woken up by a barking dog. What does that do to hormones? There's no real world evidence. And that's what we're trying to do, is bring real world data and turn it into real world evidence. So when we ask you, because I know all of you are going to sign up for the Creaky Joints newsletter, and when we ask you come Labor Day to participate in giving us some feedback and telling us some of the things you're experiencing in the real world, it's exactly for that reason. So we are no longer treated like a specimen in a vacuum.
Hi. I wanted to know if there's a natural way of dealing with some symptoms of scleroderma, and also, does stress have a factor in it, and if so, how important is it?
I made a promise to my wife when I married her on June 28th of last year. I said, that's okay. I said, honey, I'm gonna do everything I can to make sure you're happy. I'm gonna go way out of my way, and I promise to clean up after myself in the bathroom and blah, blah, blah. In return, please, honey, under every circumstance, by the love of God, please keep our stress level low in this house. Let's not manufacture stress for reasons we don't need to. When you think about the stress we have in our lives and you get really analytical about it, we make most of it up. 99.8% of it is manufactured stress. And stress is associated with inflammatory and autoimmune-related conditions by a factor of 1. Stress, and autoimmune, and inflammation are connected. So lowering our stress inevitably helps our bodies. It gives us time to rest and to heal at night. It gives us an opportunity to feel good. And I've had so much fun learning about all the great ways to de-stress. The latest is lucid dreaming. I took a course in lucid dreams the other day, and this is unrelated to the marijuana question. And it's all about going to sleep at night and putting myself in the mind frame of relaxing and then controlling my dreams so that my nighttime dreaming can actually make me wake up feeling better. Haven't gotten there yet, but that's my goal. So when it comes to some of the non-pharmacological treatments of some of these conditions, I go right to stress. So I'm glad that was your other. I think we have time for 2 more questions, and then we can visit afterwards.
I didn't really have a question, I have a comment. And that comment was talking about real-world experiences. One thing that is happening at this conference this weekend is Dr. Leslie Sakatu is running focus groups. and several of us were in one last night about gastrointestinal issues, and she's looking at solutions to the problems that patients are experiencing. And some people here who are having interstitial lung fibrosis could still sign up for her one that's taking place at lunch today. I just wanted to put that out there. Thank you.
Do it. Yeah, these real-world focus groups are definitely important. And while that mic is going back to the back row, I think there she is for our last question, I just want to make sure, one more time, sign up for our newsletter, because we have a whole section full of things that are available to you. You know, whenever a company calls and says, I'd like to do a survey of patients of you guys, I don't even blink. The first thing I say is, how much are you going to pay them? You know, like, what are you going to offer the patients? You know, otherwise I'm not interested in promoting it. And so I'm trying to find ways, too, that, you know, we can get compensated for our time, even if it is 10 minutes sharing a little perspective or things that we want or need, so that, you know, whether it's a paid or unpaid focus group or survey or market research project, do it, because it's the best use of your time. You'll help other people. So it's cool that GI is the topic, because that's a really important one.
Good morning. You mentioned weather and arthritis and all that. I have migraine headaches and arthritis and everything else. And if you go on www.weather.usa, it's the weather station. Then you key in your city. You can click a button if you have allergies, and it will tell you what your allergies will be that day, whether it's a possibility of being a bad day for that, or arthritis, or...
Yep. So there's the pollen count, which is important for allergies, and then I've always dreamed of having the AccuArthritis forecast.
Right,
know?
it'll take
I
you
don't
to
care
a-
if it's going to rain, just tell me what my pain will be.
Right, it'll tell you about migraine headaches. All you do is click on the migraine headache at the top of the bar, and if I wake up and feel like I have one, I go to the computer to see if I'm right. But it's weatherusa.com, and I found it's the only weather thing that you can click on for what you want.
Sweet. Yeah, we'll definitely check that out. That's cool.
We have one question.
Yes.
Hey, Seth. I'm Cindy from Texas, and you're going to be my excuse this weekend because I'm in Lynn Lauber's writing class and I'm late on assignment. But my question is, I'm 13 years in scleroderma, and I always thought clinical trials, not going to be that guinea pig. Well, about 4 years ago, I just said, you know what? What's the alternative? So I might as well try. And I've done about 4 of them. The 4th one, I couldn't handle. It was worth being sick for that short time. And I always made sure they understood I don't want to be the placebo person in a roundabout way. And all that to say is, you might have a medicine that works, but once it's approved, that approval process through the FDA is so long, and you have to give up that med. Do you have anything or a comment to say about that?
We are working relentlessly on fixing that. I just have certain pet peeve projects I think about all night, and I know they're giving me this sign, so I'll just take 2 seconds here. The first is, I believe strongly, by the way, that anybody that participates in a clinical trial ever should get that drug, if it works, for free for life. Done. Done. More importantly, or as importantly, I should say, there are a lot of people who participate in clinical trials, and with thousands of people involved, it might work for some people and not for others, and they then decide to cancel or stop that trial. What happened to the people it was working for? Shouldn't they have access to that medicine? So we're fighting really, really hard to evolve the way the industry thinks about clinical trials, and remember that humans are on the other end of them, and they have to treat us with humanity and respect, and understand that A, we deserve the medicine we just helped them learn more about, and B, they should do it in an ethical and also in with humanity and with respect. You know, really is my thing. The other thing, and the other thing that I'm going to go home here today, literally to start working on is, I've decided recently I'm done with the commercials. Yep. For every dollar pharmaceutical companies spend on advertising their side effects, they ought to spend at least 25 cents on patient services and patient education. That's it. And that's what we do. We get to dream up these advocacy positions. We get to think about what's right, and then we get to lead all of us to a brighter future and to a better tomorrow. I'm really glad that we had a chance to be here together. I look forward to visiting with you all. Being here means you're going to leave feeling better than when you came. Thank you for doing that, and God bless all of you.